Good day, friends, and a warm welcome to the 42nd episode of 4D, Detailed Discussion and Dialogue in Indian Diabetes. Now, in 4D, we try to create a four-dimensional picture, a multi-dimensional picture of the syndrome of diabetes that we all face, that we all have to tackle. It is difficult, but it's not impossible. And if we get together in discussion and dialogue, we are actually able to overcome the challenges that we all face. In 4D, we bring to you experts from across the world, from across the country, people who are actually working very hard to manage diabetes. In their own style, each and every person is a champion of diabetes care. And allow me to introduce to you on this 42nd episode one such champion from Mumbai. A warm welcome to Dr. Pinkesh Rajput.
Namaskar. Thank you so
Namaskar,
much, sir.
Doctor. Dr. Pinkesh is a graduate from Government Medical College Miraj and then a postgraduate in medicine from Government Medical College Nanded, both in Maharashtra. He has worked in eminent hospitals of the state like Jaslok, Bombay, and JJ Group of Hospitals, all in Mumbai. He has been a lecturer in Sion Hospital as well and has taught undergraduate students. Currently, he is founder and medical director of the Get Well Clinic, which has three branches located in various areas of Mumbai. Along with his Indian expertise and education, he is also a postgraduate diploma holder from the Royal College of Physicians UK and an international associate member of the American College of Cardiology. Warm welcome, Dr. Pinkesh.
Thank you so much, sir.
Dr. Pinkesh, your topic for today is prevalence of diabetes and prevalence of complications. So,
Yes, sir.
of course, we'll be speaking about that. But in your practice now, it's 2 decades of practice now. If you include your life as a student, what differences have you seen in the prevalence of diabetes in Maharashtra?
Sir, in Maharashtra, especially if we consider the last 2 decades, the moment we started studying MBBS and currently, as per 2023, there's a huge difference. There's a huge number of rise of patients with diabetes. And still now also, even after diagnosing, like almost the current scenario as per the ICMR is around approximately 90 million people suffering from diabetes. Still, we consider that 50% of the patients are yet to be diagnosed. Out of every two adults who have diabetes, only one is diagnosed, one is still silent or undiagnosed. And that is maybe because of lack of awareness and lack of yearly checkups or routine checkups in the Indian scenario. So, but drastically, if we see, earlier we used to say before 2 decades, diabetes सिर्फ पैसे वालों की बीमारी होती है, सिर्फ पैसे वाले लोगों को diabetes होता है. But currently, if you see, all the even the below poverty line people, lower middle class, and higher class, each and every class is suffering from diabetes, and that may be because of the lifestyle changes in the last 2 decades and the amount of junk food and the sedentary lifestyle which people are living currently. That is what we have faced, sir, in the last 2 decades.
Thank you. With this introduction, a warm welcome, Dr. Pinkesh, once again, and we look forward to listening to your talk. The floor is
Sure.
yours.
Thank you, sir. Thank you so much. Hello, friends. My name is Dr. Pinkesh Rajput, and I am a consultant physician and a diabetologist practicing in Mumbai, Sion, and Chembur area. And today we are going to talk about the prevalence of diabetes and the prevalence of complications of diabetes. So, with today's topic, you will understand why diabetes control is very much important and why you should continuously have a monitor over different tests of diabetes to keep in check to prevent the complications, or if you are already suffering from some complications, to prevent the further deterioration of the complications and thereby to prevent the mortality and morbidity. Thank you. Can we start with the slides? So today we are going to discuss the prevalence and complications of diabetes, and nearly almost in the last few decades, almost in the world, there are totally more than 400 million people suffering from diabetes. In India alone, there are more than 90 million people suffering from diabetes, and still the figure is not complete because it has been uh, observed that out of every two adult people who are suffering from diabetes, only one is diagnosed, another is yet to be diagnosed because the number of tests are much less. Sometimes the patient may reach to the doctor and then suddenly find out that the patient also has diabetes along to the acute complaint with which the patient reached the doctor. Next slide. So diabetes in India, if you see, as I already mentioned, every 1 in 2 diabetic is not been seen. More than 90 million people are suffering from diabetes. And in general, if you see in the observing the last 3 decades, there is a huge rise. Currently, India labels as the second world's most largest country with having diabetes. Next slide. So the same data shows, according to the ICMR and NCDIR, the prevalence of diabetes is almost 19 to 11 to 13%, and combination may be different. Next slide. So National Urban Diabetes Survey, again, it shows that the prevalence of diabetes is different in different areas, ranging from 10% to maximum of 16%. Next slide. Complications in diabetes are different at different stages of diabetes, plus the control or uncontrolled diabetes matters. So microvascular complications as well as macrovascular complications are there, ranging from peripheral vascular disease to diabetic retinopathy, diabetic nephropathy, cardiovascular complications, plus sometimes you may lose the sight, you may lose, the patient may be deteriorated in such a way that it may lead up to dialysis. So these are the different complications. The main reason are poor glycemic control, and the variability and susceptibility to the complications exist as per the different readings of the patient, the compatibility of the patient with regular checkup of blood pressure, blood sugars, and regular follow-up with the doctors. These are all the factors which affect whether the patient will have complications or not. Other factors involved are also increased risk of diabetes associated complications. Next slide. So these are all the same slides which I've already discussed. We see retinopathy, nephropathy. Next slide. So different macrovascular complications are seen. Cardiovascular disease are the main culprits because a number of deaths are related to the cardiovascular diseases, especially in an uncontrolled sugars diabetic patients, where the HbA1c is above 9. And if you see, out of every 10 deaths, almost 7 deaths are dedicated to the cardiovascular complication in a diabetic patient. Next slide. So what are the key strategies to manage the diabetes and associated complications? If you control the sugars well in range, the glycemic variability is being reduced, then definitely the benefit to the patient in the long term is much more by reducing the complications and preventing the morbidity and mortality in the patient. So the simple things which a person can apply, or as a physician we can take care of, is to advise the patient. So first of all, take time to mainly educate the patient and make aware the patient about the lifestyle changes, which includes diet and regular exercise. In diet food, you can just simply say to remove the junk food, remove the fatty foods, especially the fried foods and red meat. In regular exercise, you can tell the patient minimum 30 minutes of walk every day, or gymming, cycling, swimming, anything which is having 30 minutes of physical activity every day. If not every day, at least 5 days a week out of 7 days. Second, keep an eye on the blood sugar levels. Your fasting blood sugar levels should be below 140, and your postprandial, that is after food 2 hours, sugars should be less than 180. And random blood sugar in 24 hours, anytime, no matter what you eat, when you eat, any time of the day, your sugar levels should be less than 200. So if you keep an eye on your blood sugar levels, definitely they are going to help you in the long term. And be regular with the medications. Do not skip the medications, especially when you're having insulin. Try to take it at the same time, or at least plus minus half an hour of the regular time of the day. Control the cholesterol levels. It has been observed that normally dyslipidemia is found in maximum number of patients with diabetes. So you have to take antilipidemics to control the cholesterol levels. Plus take care of the kidney. If any issues are there, do a regular renal profile checkup, minimum 3 months or sometimes even 6 monthly if your kidneys are quite good. And EGFR test once in a year. Along with that, urine albumin creatinine ratio. These are all the different tests which your doctor will advise, and will take care that whether there is microalbuminuria present or not, and thereby take care of your kidney. Lose weight. If you're over obese or overweight, try to lose minimum 5% of your current body weight in a period of 3 to 6 months. Practical and oral good hygiene. Sometimes diabetes may affect the teeth and the gums. Next slide, please. Treatment strategies for diabetic patients. So early initiation of the combination therapy is the first and foremost. Gone are the days where only plain metformin was used as the first line drugs. In today's scenario, DPP4 inhibitor along with the metformin combination, or SGLT2 inhibitor along with the metformin combination, is the first line drugs which normally the people are using currently. So novel medication therapy, as we already discussed. Next slide. SGLT2 and DPP4 combination for the tight control of glucose is the first and foremost earliest. Triple combination drug nowadays we are using is SGLT2 inhibitor along with the DPP4 along with metformin, which gives a fabulous result. The pill burden is reduced in the patient, and if the HbA1c is above 8 or above 9, you see drastic decrease in the HbA1c over a period of 3 months, more than 1.6% of HbA1c. Plus, it has the benefit of dual benefit of decreasing the appetite as well as protecting the kidney and the heart. Yeah. So in today's scenario, if you see, diabetes is a major issue. It is like an epidemic which is spreading out in India, especially, and throughout the world. In India, more than 70 million people, right now, currently 90 million people are already diagnosed with diabetes, and out of which more than 50% people are diagnosed at the time where more than 50% of the beta cells are already exhausted. So if you want to control your diabetes in the early stages, especially in the first 5 years of life, if you control the diabetes in a very well manner, your complications of diabetes are being reduced drastically. Diabetes alone is a silent killer. If you control the sugars, if you control the diabetes in the early 5 years of your diagnosing, it will be much better in the long term. Even after 20 years, the memory of the glycemic memory remains, and it saves the patient from different early complications of diabetes. So thereby, if you see, diabetes alone can cause microvascular complication and macrovascular complication, starting from blinding the eyesight, that is diabetic retinopathy, affecting the kidneys, diabetic nephropathy, affecting the heart, having multiple cardiovascular complications starting from heart failure to myocardial infarction, and so on and so on. Similarly, other complications are uh, neuropathy, that is tingling sensation or numbness in the legs is there. Sometimes it may lead to peripheral vascular disease. It may also lead to amputation of the legs. So these are very deadly complications of the diabetes if they're not well controlled. In general, if you control the diabetes by three things: first is the lifestyle modification, second, regular medication, third, regular follow-up with the doctors with regular test. So first, lifestyle modification, we have seen it is diet and exercise. That is, if you are a sedentary lifestyle worker or working in an office for 8 hours, you should immediately start having a 30 minutes of exercise. It may be cycling, walking, jogging, or swimming, or any physical activity which makes you sweat for 30 minutes and increases your heart rate. At least 5 days a week, if not 7 days a week. And don't be a weekend warrior where you only go on Saturday and Sunday and then work out for almost 2 hours. No. Every day, do it for minimum 30 minutes. If more to 1 hour, well and good. Similarly, if you want to go with uh, different kind of diets, simply adding in your daily routine high amount of protein, low amount of carbohydrate, low amount of fat. In general, try to cut down on carbs, especially roti, chapati, bhakri, rice and all. Cut down in a bit of amount. Increase the number of increase the number of cups of dal you are drinking. Take 1 to 2 cups of dal extra than your daily routine, and also take 1 to 2 cups of salad. Take 1 to 2 cups of bhaji extra than your routine. So you do not decrease the quantity of your diet, you just change your diet. Do not decrease the quantity of your diet, change your diet, reduce the carbohydrate stuff, increase the protein stuff and the salad, there is fiber stuff. Similarly, if you're coming in simple words, avoid all the packet foods, avoid all the junk foods, especially Bakery foods or sweet foods you should be avoiding. Oily and deep fried foods you should be avoiding. Similarly, medication, whatever suits you may not be for a lifetime. So do not eat continuous medication for 2 3 years without following up with the doctors. Every 3 monthly do one HbA1c test. Every monthly do minimum of fasting and postprandial. Every 6 monthly do a lipid profile. And whenever you feel much more dizziness, giddiness, perspiration, palpitation, sweating, or too much of hungry, immediately check your random blood sugar and immediately rush to the doctor if it is low or if it is very high. In general, the markings which you should remember is the fasting blood glucose should be less than 140, postprandial blood glucose should be less than 180, and any random blood sugar in the day should be less than 200. HbA1c is a very important tool, which is a prognostic tool. So HbA1c, according to the various guidelines, it should be less than 7, and if you are strictly controlled, it can be controlled less than 6.5. So this is all with the medication and the test, and regular follow-up with your doctor, either monthly, 2 monthly, 3 monthly, 6 monthly, whenever your doctor feels feasible that you should follow up with him or her. Do follow up them with the regular medication, regular blood test. If you do this basic test, your life will be healthy, wealthy, and happy. This is all for today. This is the reason why we are talking prevalence of diabetes and complications, because the number of deaths in India because of diabetes and because of the complications of diabetes has been risen drastically from the past 2 decades. And that's why we want to make India much more healthier, fitter, and better place to live. मर मर के जीने में कोई फायदा नहीं है. जीना है तो फिट जीना है. Even if you have diabetes or even if you have minor complications, consult your doctor regularly and be fit till your last breath. Thank you so much.
So, Dr. Pinkesh, thank you. That was a wonderful talk. You've spoken of the prevalence of diabetes, and you've also told us how things have changed over the past few decades. Now, diabetes is occurring more and more frequently. It's occurring in younger people, and it's occurring in people of all socioeconomic groups. What about the complications of diabetes? So, let's structure this question. First of all, the acute complications of diabetes. How frequently did you see them when you were a postgraduate student in Nanded? How frequently do you see them now that you're a consultant in Mumbai?
So there's no much difference as such, but if the diabetes is uncontrolled in our practice, normally, sir, 30 to 40% of the patients definitely have some or the other complications of diabetes. And especially in the uncontrolled diabetes or people who are having HbA1c above 9, the complications of diabetes are almost more than 50% of the times. And in acute cases, generally when the patient falls sick, we have seen acute kidney injuries commonly. And sometimes if the patient also has comorbidity of obesity and hypertension along with diabetes, we have definitely seen some cardiac events, starting from heart failure to acute MI. All the features and complications we have seen in our practice, sir.
So the acute complications that you mentioned are acute vascular complications, whether renal or cardiac, and also acute
Yes,
metabolic complications, like
absolutely,
maybe
sir.
hypoglycemia or DKA.
Correct.
What has happened to the chronic metabolic complications? Have they increased? The chronic vascular and the chronic metabolic complications, have they increased over the past 2 decades, or because of better control, are they coming down in Mumbai?
Sir, exactly speaking, people, it varies in the group of the people and the knowledge of the people and the follow-up of the people. So I cannot say that it has particularly increased, but in general, yes, as compared to the previous 2 decades, the number of diabetes people is also increased, and the number of diabetic complications in diabetic people has also increased. So overall number of complications in diabetic people is much, much more today as compared to the previous one, both. So
So,
basically, it caters to two things, sir. Those patients who are strictly controlling diabetes, checking regularly the diabetes, following up well with the medicines, those are having no issues at all. But those who are having uncontrolled diabetes, definitely the number of complications is much high. And the patients in the initial years, especially when the young patient is there, they take it very lightly because they is like, Doctor Saab, आप बोलते रहते हैं शुगर बढ़ गया, but I don't have any symptoms. उनको कुछ भी तकलीफ नहीं होती है, and still the HbA1c is 8.59, And when you explain it to them, the importance of HbA1c, they are still reluctant in saying that कुछ तकलीफ तो नहीं हो रही है ना, अगर इतना तकलीफ बढ़ा हुआ है रिपोर्ट, there should be some symptoms. So many a times there is a wrong conception in the brain of the patient that something is wrong in my body, I should feel symptoms, and that's not true at all. Every time the patients who comes uncontrolled diabetic may not have all the symptoms. Sometimes we see in our practice patients having sugars above 250 or 300 but still having a normal lifestyle, but internally the damage is going on and the complications are increasing. Thank you, sir.
That's a very important point, because when we read Western guidelines and Western literature, we are made to believe that diabetes is a chronic disease. We are also made to believe by those of our
Correct.
colleagues, our friends who work in the US or in the UK, that diabetes is a cold disease, a relaxed disease. There is never any acute complication, no emergency. So, from an Indian physician's perspective, would it be right to say that diabetes is both an acute and a chronic disease, both a hot and a cold, an
Absolutely.
emergency and a cool disease?
Absolutely yes, sir. Absolutely yes. So it's like, for example, people do not understand the scenario that I'll give you an example. I would like to resonate with an example of smoking. When the patient drinks one cigarette or two cigarette, immediately the patient do not get a heart attack or nor a lung cancer nor any other cancer in the body. But that same patient, when he smokes for a longer period of time, suddenly some or the other day he may get an acute myocardial infarction, he may get an acute renal disease, and he may get a cancer suggesting metastasis sometimes when diagnosed. So it is both acute as well as chronic, sir. Diabetes, we consider it as a very naive thing. Some people take it very lightly, but it is responsible for both acute as well as chronic complications, directly or indirectly, but it is the main culprit behind multiple complications. Thank you, sir.
And what this means for all of us who are watching 4D, it means that as physicians working for our patients, we have to wear two hats at the same time, an acute hat and a
Correct.
chronic hat. So, with time,
Yes.
you learn, you evolve. The difficult way, actually, Dr. Pinkesh will join me in saying that you are not taught these skills in medical college. You learn which patient to approach in a chronic manner, which patient to approach in an acute manner, and you learn how to sort of change the speed and velocity with which you are responding. You also learn how to understand the patient's complaints and concerns and then manage accordingly. With
Yes,
this,
sir.
I'd like to thank everybody for having been part of this 4D episode. And Dr. Rajput, particular thanks to you. We appreciate your time. We value your
Thank you, sir.
expertise and eminence. Thank you for joining us today. Jai Hind.